My name is Laura Soares from VEHI. I am here to talk about the 4 health plans that VEHI will have available to you January 2018 to help you make a plan choice. My understanding is you have a couple of weeks until early November in order to make your plan choice. And if you have any questions at the end of this presentation, I'll give you a phone number that you can do some personal follow-up on. So there were 2 handouts that you want to get a copy of, a half a sheet of paper and a full sheet of paper. The presentation on the screen is online at vehi.org. I'm actually only going to do a few slides, but the whole presentation is online. And also online, and I think you have copies, is our benefit booklet. This actually replaces what I call the school bus guide. It was one of the people from up here in your neck of the woods, I understand it was on the cover of our guide for a year, and we've now updated it. So this is the latest guide. You should have paper copies available to you, and you can get it online. I did copy 1 page from this booklet that I will refer to during the presentation. So I want to explain what the half a sheet of paper is, and then I'll start talking about the health plans. So when you enroll in a health plan, there is a premium that is paid to VEHI by your employer every month that you're enrolled in that health plan, and that same amount of money gets paid to us whether you're healthy or sick, whether you ever use the health plan or not. So that premium amount is on this half a slip of paper, and it's gotten a little more confusing because I'm giving you 2 sets of rates here, but if you start down at the bottom where it says VEHI VHP FY18, the vast majority of school employees right now is in our Vermont Health Partnership Plan. We call it the VHP. And right now, if you're a single person enrolled in that plan, your employer is sending VEHI $752.41 a month in order for you to be enrolled in that plan. Whereas if you're in a family VHP, it's $1,982.66 a month. Okay? That is not what you pay. How much of that is your share is actually decided at the local level at the collective bargaining agreement. So across the state, some employees pay 14%, some pay 11%, some pay 20%, and I don't know what you pay. That's up to your collective bargaining agreement. So this amount is not what you pay. It's what your employer pays in total, some of which probably gets deducted from your paycheck. It's VEHI's only source of income, and we collect all the premiums from all over the state, and we use that to pay for all of the medical claims that come through the door, run our wellness program, hire Blue Cross to administer the program, deal with all the state and federal rules and regulations and fees, okay? And all of that money goes to work on your behalf. So we really have your money, and we try to use that as wisely as possible because we appreciate the value of keeping as much money with you as possible. So if you look at our 4 new plans, we called them the VEHI Platinum, the VEHI Gold, the VEHI Gold CDHP, and the VEHI Silver CDHP. I'll talk about what the CDHP stands for in a minute. But if you look at the top left corner, you'll see that the Platinum plan in FY18, so starting in January and running for 6 months, from January to June, will be $657.55 a month. Next July, in FY19, it will be $699.34. Now that's the rate that we've requested from the state. They have a couple of months to approve it. So the plans are going up in July. And so I've given you both sets of numbers. What you'll notice is that every single plan in the new plans is significantly less expensive than the single price you're in now. Okay, so there's premium savings to be had. So if you were currently paying 85% of the VHP and you're paying 85% of the Platinum, that is a smaller amount because you're starting with a lower premium. So that's one of the numbers. It's important as you make your plan decision that you look at the premium, how much it will cost you out of your paychecks to be enrolled in the different plans, and you look at the out-of-pocket cost in each of the plans. You have to look at both of those. If you look at one and not the other, you won't have all the information you need to make the best decision for yourself. So when people think about healthcare, they tend to worry about three things. Is it covered? Can I see my doctor? How much does it cost me? So I'm going to talk about those three questions, and I'm going to talk about the 4 new plans, and I'll also briefly refer to our current plans so you know sort of what's changing. So the first thing to recognize is that all 4 of our new plans continue to have excellent benefits, a broad network, and lower premiums. So you cannot pick a plan in 2018 that isn't going to give you great coverage, great networks, and lower premiums. What is different between the plans that we have now and the plans that we have in 2018 when it comes to benefits? There are 3 changes. Okay? And all of this is described in the book, but I will just give you the highlights. So one thing has improved in 2018, and that is that all 4 of the plans in 2018 will have a vision benefit. That's not in all of our plans now. It's in the VHP, but it's not in any of our other plans. So all 4 plans will be identical to each other, and they will all allow you to have 1 vision exam a year. It's where you go to the doctors and you can get a prescription that you can take to buy glasses or contacts. Doesn't cover the glasses or contacts, but it covers that exam. So that's new for some of our plans. The other 2 changes are in the pharmacy arena. There are 2 types of drugs that we will no longer cover in 2018. Vermont Health Connect does not cover them. It's very unusual for health plans to cover them, and so we decided that we would stop covering them in 2018. One of those is infertility treatments. It's the drugs to support infertility treatments. We never actually covered the actual infertility processes. And the other is sexual dysfunction drugs, such as Viagra, which is going generic later this year. So other than those 3 changes, everything that's covered today is covered in the new plans. Maternity care, urgent care, chiropractic care, physical therapy, wheelchairs, pharmacy, maternity. All of the things that we've covered today, except for the things I just mentioned, are covered in 2018. So you're not going to go to a plan that doesn't cover something, and you can't pick a plan that if you had only known, you would have picked a different plan, okay? So what about the second category? Can I see my doctor? That's called networks. So we are actually expanding our network. Right now, most of our subscribers are in the VHP plan, and you actually have to stay in the Vermont network. We are going to expand so that you have the entire national, international Blue Cross network. You can go to any doctor or hospital in the country that is connected with this Blue Cross network, one of the largest networks in the country, without getting prior approval. Now, that doesn't mean I can just go get an MRI when I leave here today because I'd like to see what I look like inside. I still need prior approval for certain things like an MRI. So if I need to get approval in the network now, I still need to get approval in the network in 2018. But if I need to get my knee replaced, I'm not limited to going to an orthopedic surgeon here in Vermont. I can now go to an orthopedic surgeon in Boston or New York or Chicago, where as long as they're in that National Blue Cross network, I can go to them instead of staying here in Vermont. You can go and see in our booklet, you can go into the Find a Doctor and see it's all of the network you have now in Vermont plus expanded. So what's the catch? Well, the catch is you have to stay in the network or you won't get any coverage whatsoever unless you get permission ahead of time. It's an emergency or an urgent situation. You never have to ask in the middle of an emergency or an urgent situation as the ambulance is picking you up, are you taking me to a National Blue Cross network? You don't, we'll cover it. But let's say my sister got her knee replaced in Boston by this surgeon that she really loved, and I want to use the same one because I like trusting my sister, but that one surgeon in Boston that she used isn't in the Blue Cross network. I'm going to have a hard time getting Blue Cross to approve me using that surgeon when there are thousands of orthopedic surgeons in the Blue Cross network, unless I can convince her that there's some rare family condition that only this orthopedic surgeon can deal with. Okay? I'm going to have to stay in that network. Yes?
So, just a real quick question. When you say changes for 2018, does that just mean the first 6 months till July 1?
So, no. There's 3 levels of answers to that question. First of all, these plans go live January 1st, 2018, and they are plans for the foreseeable future. Okay? Our premiums, which are the rates on this page, which is the monthly costs, our premiums are always set on a fiscal year. So we introduced last year the rates that started in January and went through July, and now we're introducing rates that will go next July through next June.
That's based on the same coverage currently?
Yes, yes. Now the third level to that has to do with your out-of-pocket costs, which I'm going to get to in a minute. And that's on a calendar year basis, and I'll talk about that. So before I get into what does it cost me, we have 4 excellent plans. They all cover the same comprehensive benefits, and they all give you access to the same comprehensive network. We've also added a new tier in 2018, and you can see this on the piece of paper. We no longer, you just pick between a single plan, a 2-person plan, or a family plan. We have a new tier called parent-child or parent-children. It's a lower premium than 2-person or family, and it's a plan that is works for people when there's 1 adult and any number of children. So if you're a single parent, instead of being in the family plan with a bunch of your kids, or maybe 1 child, you're in that 2-person plan, you can move to the parent-child tier and have a lower premium cost. But it's not just a single parent. You could be a 2-parent household where one spouse is going to take single coverage with their employer and the other spouse is going to take the kids with their employer and enroll in that parent-child tier. So it is available to you. So what is it about then? If we've got great benefits and they're identical to each other in networks and in benefits, then it's about the out-of-pocket cost. Okay? And as I said, the premium is paid by your employer. Some part of it comes out of your paycheck, but it's paid by your employer to VEHI every month, whether you are sick or healthy. Out-of-pocket costs are your responsibility, and they are paid if and only you need coverage where they apply. Okay? So if you never use our health care, you will never pay out-of-pocket costs. If you use a lot of health care, you will have out-of-pocket costs, but the good news is there's a cap or a maximum that you could possibly pay. And out-of-pocket costs are always on a calendar year. So they start tracking in January, and they go through December, and the next January we start again. Now when I say they're your responsibility, your employer is actually giving you a significant amount of money towards helping you with your out-of-pocket costs. And so you need to take that into account. I will speak to that briefly because I was told generally what that is, but you really need to talk to your employer for details on that. But when I talk about out-of-pocket
right here
costs,
if you have questions. No.
When I talk about out-of-pocket costs, I'll talk generally first, then I'll tell you what I know about your employer, then I'll go back to my presentation, okay? Is that out-of-pocket costs, when I say you, I mean not VEHI, okay? It might be you and your employer, but it's not VEHI. That's how I'm going to use the word you. So out-of-pocket costs come in 3 types or 3 flavors. They come in co-payments, which you're used to. You pay $25 to go to the doctor. No matter what happens there, you pay $25, VEHI pays the rest. So if that's a $225 office visit, you pay a flat $25, you pay the other $200. If it's a $325 office visit, you still pay $25, we pay the other $300. That's what a copay is, it's a flat amount. Okay. Deductibles. Deductibles are in the hundreds of dollars, and when there's a deductible, you pay that first before VEHI starts paying. After deductibles come coinsurance, and coinsurance is when you and VEHI share. You usually pay 20%, we start paying 80%. And we will track all of those costs, and you can find them at any time you want. You can go online, you can call Blue Cross, you'll actually be getting something called EOBs, or explanation of benefits. You've been getting them in the past, but if you're like me, you've never opened them. You'll open them up and you'll look at it, and it'll track for you what's going on. But we will be tracking that, and if you hit the maximum in the calendar year, you will stop paying no matter what you need for health care, and VEHI will pay the rest for the rest of the calendar year. Okay, so that's the concept. Now I'm going to talk about our 4 plans and how they work. And I'm going to ask you to go to page 23, or actually you're not in the booklet, but if you're watching me on the screen, you can go to our booklet online to page 23, the handout. I'm going to go use this as my framework. But before I do, I want to talk about what your employer is willing to do for you when it comes to out-of-pocket costs, no matter what employee group you're in. Okay? How your premium share depends on your collective bargaining agreement and what your employee classification is. But your employer has, through the collective bargaining process, has said if you're a single person, you will pay the first $125 of your out-of-pocket cost. If you are in a plan with anyone else, your parent, your spouse, 2-person, your parent-child tier, or your family, you'll pay the first $250. So $125 for a single person, $250 if you have more than one person. After that, no matter what, and this is true no matter what plan you choose. After that, no matter what plan you choose, if you're a single person, your employer will give you $2,250. They won't give it to you. It'll be available to you in something called the health reimbursement arrangement. $2,250 for a single person, or $4,500 if you have more than one person. And that money is available to you to pay for these out-of-pocket costs. And if you use it all up because you have a lot of care, or you have knee surgery or something that will go through it, then anything left at the other end is yours. And depending on which plan, you will have different amounts that are possible for you to pay at the end before you hit that cap. So that's what I'm going to talk about now, how they work. I'm going to talk briefly about the Platinum and Gold plans, and then I'm going to talk about the 2 CVHP plans. Your collective bargaining agreement is actually pegged to the Gold CVHP plan, so it's been designed so that you have the least exposure at the back end. So I'm going to spend the most time on that plan, but you can choose any one of these 4 plans, so I'm going to talk about these plans as well. When you make your choice on which plan works for you, you're going to keep that choice for a year. And once a year, you can decide whether you're going to stay in that same plan or you're going to switch plans. And you're going to make that decision based on what is your employer doing the next year for you and what's going on in your own life. But when you make the decision, it's a 1-year decision. It's not a lifetime decision that you never get to revisit again. So the Platinum and Gold plans look at medical and pharmacy as 2 different tracks, and we keep track of medical costs and we keep track of pharmacy costs, and it's possible that you can hit the maximum medical and still have pharmacy, or you can hit the maximum pharmacy and still have medical. And the way your employer is helping you is it's applying that your $125 or your $250, doesn't matter whether it's medical or pharmacy, whichever you use first. That's what your money will go to, and then you can use the employer HRA money for either kind of service, and then it'll be back to you. So far, so good? Yes?
Who tracks that? How do you find out that?
So Blue Cross tracks it on our behalf. You can go, you can sign into Blue Cross, their Member Resource Center, and it will show you. You can call up Blue Cross and ask them anytime you want, or every time you have a service. Once a month, Blue Cross sends those EOBs, and it will list it right there, right on the front sheet.
My understanding is, and Mark correct me, is future planning is going to be handling all of that for everybody. You're going to have a credit card that does all of that. They keep track of the 250 and then the 4,500 and then the last 250. Is that right, Mark?
So it's integrated, right. So you're responsible for the first 125 or 250, depending on your plan. you'll have a debit card, a healthcare debit card for the HRA, and then they will keep track of when you've spent that piece and if there's anything left.
But you can go in and look anytime you
Yeah.
want to. So let's take a look at this handout. Let's go to the middle section, service categories. The very first service category in the middle section is called preventive care, and you see the $0 all the way across. In any one of these 4 plans, you get your preventive care for free without ever spending any money. So you won't have to spend your money on preventive care. There's a whole page in this booklet on what is preventive care. But it's things like mammograms, colonoscopy, well baby visits, your annual exam. Okay, those won't cost anything. Those are the same in every single plan. At the bottom of the middle section, you'll see vision exam, and you'll see $20 all the way across. So in every single plan, if you go to get that vision exam, where you're going to get your eyes checked to see if you need glasses or contacts and walk out with the prescription, it's a flat $20 no matter what plan you're in. In between that, our plans work differently. So in the Platinum plan, you'll see under preventive care, you see primary care office visit. So if you go to your primary doctor, and you have to pick who's your primary care doctor, most of us have that picked already, but if you don't, you are going to need one. You can change them once a month, so you can pick one and then decide that something else works better for you. But if you go to your primary care, not for your free annual exam, but maybe I've got a well, I wouldn't go with a toothache, probably I'd go to my dentist. If I go because I have the flu or something's bothering me, not for my free annual exam, then I'll pay a flat $25 copay. VEHI will pay the rest. Okay? If I go to a mental health care provider, it's a flat $25. If I go to any other kind of doctor in their office, whether it's the chiropractor in their office, or whether it's the dermatologist, or the cardiologist, or the ophthalmologist, or the OB-GYN, I'm going to pay $35. Very similar to what we're doing now. If I need to go to an urgent care center, I'm going to pay a flat $75 in the Platinum plan, no matter what happens there. And in the Platinum plan, if I need to go to the emergency room, it's a flat $250, and everything that happens in the emergency room is covered. All of your other services, the ambulance, durable medical equipment, which are things like crutches or wheelchairs or your cast, radiology, x-rays, MRIs, CAT scans, inpatient or outpatient, you're going to pay a deductible before VEHI starts paying, and then you and VEHI are going to share with coinsurance after that. So let's look at how much the deductible is in the Platinum plan. If you go up to the top, you'll see the very first line, medical deductible, individual family, 500, 1,000 stacked. With me? So here's how it works. I'm going to tell you the story. I have a husband and a daughter, and they're in my health plan with me. So let's say we're in this plan, and my daughter breaks her toes getting hit by a car, which she did, so it's the example that I used a couple years ago. Her toes are fine, except for when she tries to dance on point. So she had an ambulance. And let's say we're in this plan, and that's the first thing that happened in our family that year. So the ambulance is subject to a deductible. Her deductible is $500. So the first $500 of that ambulance is her responsibility. Now when I say her responsibility, you know that she doesn't have $500 and she's coming to me, right? But I might have an HRA with my employer or some other kind of money. But my daughter has a $500 responsibility for that ambulance. Let's say the ambulance is $800. Then the last $300 of that ambulance is 20% is my daughter's responsibility, which is $60, and VEHI starts paying the rest. So my daughter now has, in the medical, a $500 deductible, $60 in coinsurance. She then goes to the emergency room, and there's $250 for her copay. And that's how much her medical out-of-pocket is. Now, everything in the emergency room is covered under that $250. But a month later, when she goes to the doctor's office, she has a $35 office copay because it's a specialist. And he wants another x-ray because he wants to see how the foot is healing. So now that x-ray says deductible. Well, she's already paid her deductible. You only pay it once a year. That $500 has been paid. So now she's at 20% of her x-ray, And that goes to her out of pocket. So when does it end? So it ends for you when you have paid your piece and now you're using your employer's health reimbursement arrangement, your employer money. Okay? But it ends for you, and VEHI starts paying when she reaches her medical out-of-pocket limit. So her medical out-of-pocket limit in the Platinum plan is $1,500. See that on the third line? Medical out-of-pocket limit for an individual family. My daughter has a $1,500 medical out-of-pocket limit. So if she spent $1,500 on her broken toes that year, anything else that happened to her medically would be covered 100% by VEHI. She could have a baby, she could get cancer, she could break a leg. Doesn't matter what happens from a financial point of view, her services are covered by VEHI at 100%. But now I'm in the family with her. And I'm going to get my knee replaced one of these days, and let's say that this is the year I get my knee replaced. So now I have inpatient surgery for my knee. I have my own $500 deductible. And knee surgery costs a lot more than $500. So after I pay the first $500 of knee surgery, I'm going to pay 20% of that knee surgery until I get my $1,500 in medical. Now I'm covered for the rest of the calendar year. Even if I get pregnant and have a baby. So when my husband has a heart attack because my daughter and I have both gotten pregnant in the same year, he doesn't have any medical expenses that we have to cover. Because if you look, our family can't spend more than $1,000 in deductibles. And our family can't spend more than $3,000 in medical care. Okay, my daughter had $500 deductible, I had $500. That's our family maximum in the whole year. So even if my husband needs care, or even if my sons were still on the plan, or even if I have, you know, many children, we've met the $1,000 family maximum. So that's how the Platinum plan works. So look at the pharmacy at the bottom. How does the pharmacy work? Because that was just medical. Pharmacy is its own tracking system. So here's how the pharmacy works in the Platinum, and it's actually identical to the Gold plan. It works like this. We now have 4 tiers of drugs. Currently we have 3. We're going to move to 4 tiers in 2018 in these 2 plans. So when I go to the pharmacy in 2018, if I'm picking up a generic drug, right now I'm paying $5, I'm either going to pay $4 or $10. Some of the generics will be $4, some will be $10. You can go online and find that list right now to see where your drugs fall. If I'm going to pick up a preferred brand name drug, and I'm currently paying $20 to pick that up, I'm still going to pay $20 in 2018. But if I'm taking a non-preferred brand drug, and I'm currently paying $45 to pick it up, I'm going to be asked to pay 50% of the cost of that drug up to my maximum. And if we look at the maximum, we're going back up to the top, to the prescription drug out-of-pocket limit. It's $1,300 for each person in the family, or $2,600 total for our family. So in this plan, if I'm a single person, I could have $1,500 in medical cost and $1,300 in pharmacy costs, or $2,800. Your employer is asking you to pay the first $125, then your employer is paying $2,500, and then you would have the rest of the money at the end if you hit it. If I'm in a family, it's $3,000 for medical, it's $2,600 for pharmacy, and if you add that together, it's the $5,600 maximum. You would have the first $250, your employer puts in $4,500, you would have anything at the end if you needed it. The Gold plan works very similar to the Platinum. It's identical in pharmacy. If you look in the middle, you'll notice that urgent care and emergency room are now deductibles and coinsurance. You no longer have a flat copay. You see that? So let's look at how much the deductible is in the gold plan. It's not $500, $1,000, it's $1,200, $2,400. So when my daughter gets hit by a car and breaks her toes, she has the first $1,200 deductible, which is the entire 800 ambulance. Plus, when she goes to the emergency room, instead of a $250 copay, she's continuing to pay towards that $1,200 deductible. And then it's 20% coinsurance until she hits the medical, which instead of $1,500, it's $1,800. Still my knee, I have my $1,200 deductible, and then I'm capped at my $1,800 in medical, and our family is capped at $3,600. So you might say, why would someone pick the gold plan when your medical costs are higher than the plan? Well, because the premium cost is lower. And so you've got to look at whether or not that makes sense to have a lower premium and a higher deductible. The last two plans, and again, your collective bargaining agreement is tied to the gold CVHP plan. That's kind of the anchor plan that was bargained around. So the gold and the silver CVHP plan are very similar to each other, and they work differently. If you look at this graphic up here, you don't track medical and pharmacy separately. You track them all together in one bucket. And these plans, the whole CVHP stands for Consumer Directed Health Plan. And what it means is that these plans comply with federal law to use health savings accounts. You cannot use a health savings account, however, if you take your employer's HRA money. The federal government won't allow it. So they're designed to use a health savings account. That's why they work in a particular way. But you won't be able to use a health savings account. You won't be able to put money into a health savings account when you're in these plans because your HRA is there instead. Okay? For some reason you have a health savings account from years ago, that money in your health savings account already is still yours, okay? But you won't be able to open one up and add one. So how do these plans work? Well, the first thing I'm going to ask you to do is go back to your handout, and you'll notice in the middle, you still have the $0 preventive care, okay? Preventive care is still free. You still have the $20 vision exam. But everything in between, it says deductible and coinsurance. So when you have the flu and you go to your primary care doctor to get checked out, you're not going to pay $25. You're going to pay whatever that doctor's visit costs. $75, $125, $225, whatever that doctor is charging for that. Now, you won't pay up front like you do a copay because your doctor will submit a bill to Blue Cross, and Blue Cross will verify, and usually Blue Cross lowers the price because the doctor has been under contract, and they'll give an allowed amount, and that's the amount that then will become your responsibility, and your HRA will be available to help you pay that. But everything other than the preventive care and the vision exam is deductible and coinsurance. So let's look at what this plan's deductible is and how it works. And this is important to notice because the gold CVHP, the medical deductible, individual family is $1,800, $3,600 aggregate. Okay, that aggregate means this plan works differently. So if I'm in this plan as a single person, all by myself, I have an $1,800 deductible. So if I went to get my knee surgery in this plan as a single person, I'm going to pay the first $1,800 of that knee surgery, then I'm going to pay 20% until I get to my medical out-of-pocket maximum, which is, you look at the medical out-of-pocket maximum, is $2,500. Okay? But if I'm in this plan with anyone else, myself and my husband, and my daughter, myself, my husband, my daughter, and my boys, That $1,800 to $2,500 goes away. We share a $3,600 deductible. That's what aggregate means. So when my daughter breaks her toes, she has a $3,600 deductible before VEHI starts paying anything. And then she has 20% until she hits our family shared medical maximum, which is $5,000. But that means when I need my knee surgery done that same calendar year, I don't pay anything because our family has met the shared $5,000 maximum. And when my husband has his injury or heart attack or anything that befalls him or anyone else in the family, our family is covered. Because the maximum medical cost in the Gold CDHP is $5,000. Now let's look at pharmacy. If you look at pharmacy down at the bottom on the Gold CDHP, you'll see wellness drugs, 0%. So this opportunity to have wellness medication at no cost is available to you in the Gold and Silver CDHP plans. We've got a whole page on wellness drugs, and you can go online and there's a list of hundreds of drugs that are considered wellness drugs, but they're in the following categories: diabetes, high blood pressure, high cholesterol, prenatal vitamins, asthma, osteoporosis. Now it doesn't mean that every single high blood pressure medication on the market is on that list, but many, many are. And if you're taking a high blood pressure medication or a diabetic medication or any of these categories, you'll want to see if it's on the list, because if it is, you won't have to pay any money to pick that up. VEHI will pay the whole cost of that drug. Any other drug that's not on the wellness list is also deductible and then coinsurance. So when you go to the pharmacy, if you're picking up a drug and right now you're paying $20 for it, but that drug costs $80 to VEHI and we're paying the other $60, you'll be asked to pay the whole $80. And if you were on a drug that cost $8,000 a month, and you're paying $45, and VEHI is paying the other $7,900 and change, we'll be asking you to pay all of the cost of that drug until you hit your maximum. And then VEHI will pay from there. So what's your pharmacy maximum? Well, if you go up top, you'll see $1,350, $2,700. So the first thing to notice is if you're a single person in a single plan, your maximum pharmacy cost in a year is $1,350. But if you're in this plan with anyone else, you share a $2,700 pharmacy cost. But if you look at the total out-of-pocket maximum on that white line at the top, it says $2,500, $5,000. You don't add medical and pharmacy together. Because medical and pharmacy and that little $20 vision copay is all counted together. So here's what it means. If I go get my knee surgery, I'm going to fill the whole family $5,000 bucket with that knee surgery. After that knee surgery, my family's medical and pharmacy costs are covered for the entire calendar year because we've spent $5,000 and your employer is giving you $4,500 towards that. After my knee surgery, when I go to the pharmacy, I can pick up the most expensive medication there is, and I've hit the $5,000 limit for the year, so VEHI's picking that up. But what if the first thing I did was pick up a medication before I got my knee surgery done? And let's say it was a $5,000 medication. That's what the cost of it was. It was what I needed, and I went to pick it up. I would have $2,700, and my employer would be giving me $4,500, $4,500 towards that. But I would have $2,700 in pharmacy. Then when I went to get my knee done, I would have another $2,300 in medical costs till I hit the $5,000. I can't go above $5,000 in any combination of medical or pharmacy. but pharmacy is cut off sooner at $2,700. And if I'm in the plan by myself, it's $2,500 maximum. I could fill it all up with medical, or I could have up to $1,350 in pharmacy, and the rest could be medical or any combination. Does that make sense? We do have a little video on stacked and aggregate and the CVHP plans that you can watch, and you can pause and rewind. You can't pause and rewind me quite as easily.
Could you do like a quick rewind on stack versus aggregate, or is it?
Yep. So in a stacked plan, which the platinum is stacked, the gold is stacked, and half of the silver is stacked. I haven't talked about silver yet. I will in a minute. Okay? In a stacked plan, each person in the family has their own limit, and the family has a limit. So in the platinum plan, the limit in the family is no one can spend more than $500 in deductible, and no one can spend more than $1,500 in medical, and no one person can spend more than $1,300 in pharmacy. But the family can't spend more than $1,000 in deductible, no matter how many people you have, and they can't spend more than $3,000 in medical, no matter how many people you have, and they can't spend more than $2,600 in pharmacy, no matter how many people you have. In the aggregate, which is the gold CVHP, we share the larger deductible as a family. So that $3,600 deductible is shared by everyone in the family, and one person could be responsible for the whole thing. There's no lower protection for individuals. So let's look at the silver briefly. The silver has the lowest premium. It also has the highest deductible. It has a $3,000 deductible and a $6,000 family deductible limit, and it's stacked again. So no one person in the family can spend more than $3,000 on deductibles in the silver plan. And the medical out-of-pocket limit in the silver plan is $4,000 for an individual or $8,000 for the family. The pharmacy in the silver plan is still aggregate because federal law requires it. So you're sharing a $2,700 pharmacy in the silver plan. So if I have a lot of pharmacy costs, the whole $2,700 pharmacy could be filled by me, and that $2,700 goes to my $4,000 limit. If we hit our pharmacy limit, everybody in the family is covered for pharmacy. If we hit the medical limit for the family, everybody's covered. So I'm going to simplify it for you. And I went through each one of the plans. They each have a different nuance, right, about how they work. There's some little tweak, some little quirk, and you might be saying, I can't possibly remember that all, and I don't know what to do. So first of all, we do have videos that go over pieces of what I've said that you can watch. They're 8 to 10 minutes long on VEHI.org. Secondly, you can call this number. It's on the back of the booklet, but the number is 1-800-247-2583. 1-800-247-2583. That gets you to Blue Cross customer service, and they can talk to you personally about your medical situation, your claims, your family. You can share whatever you want about your finances, and you should tell them how much your employer is helping you, and then they can help you make a decision on a personal level. But here's the summary, and then I'll take questions if you feel like there's a question that everybody could benefit from, or I'll stay individually if you have a question that you want to just catch me on. Here's the summary. We have 4 health plans. They're all excellent. They all give you access to the same benefits. There's not one medication that you can get in one plan, but you couldn't get in another one. They give you access to the same national, international Blue Cross network. They're all supported by VEHI and our wellness team and the Blue Cross team. They all have lower premiums than we have now, and they all have a maximum you could possibly spend in the worst case scenario. You're never going to be told, sorry that you have kidney problems and you need a kidney transplant. We're not going to cover it because it costs too much money. It's not how it works. Okay? You are going to get the care you need as long as it's part of the health plan, just like it is now. And if you hit your maximum, VEHI will pay 100%. The next January will start again. So how much is your out-of-pocket risk? Well, that depends on your local decision. First, you have to understand how much is going to come out of your paycheck every month when you pick the plans, because it's going to be a different amount depending on a different plan you choose. You need to learn that from your employer. Okay? Second, your employer has said you're going to pay the first $125 of out-of-pocket costs if you're a single person, no matter which plan you pick. You're going to spend the first $250, medical or pharmacy, if you've got more than one person in that plan with you, no matter which plan you pick. Then, no matter which plan you pick, your employer is going to give a single person access to $2,250 through a debit card HRA to pay for costs, and if that gets totally used up, you will have some exposure until you hit our cap. And you can do the math. I can't do math on my feet very well. But in the Platinum plan, the maximum exposure is $2,800. So if you take $2,800, you take away the first $150 that you are responsible for, and then you subtract $2,250, whatever's left is what you could pay if you needed the most care as a single person. If you are in more than one person, in the Platinum plan you have a $5,600 maximum exposure. You have the first $250. Your employer is going to put $4,500, and if you need all of that, you will have the rest. How much is that last amount is different on every single plan. So what's different for you is how much comes out of your paycheck versus how much you might have to pay at the end if you need all the care. That's the financial decision that you have to make. Any questions? Yes.
So with the goal CVHP, if my husband and I reach that, so we have a $5,000 maximum, does that mean once we pay $250, the employers pay the 90%, or the $4,500 rather, and we pay the last $250? Does that mean everything beyond that is completely covered?
For the rest of that calendar year, yes, no matter what you need.
So in other words, our maximum out of pocket for a year is $500.
If you pick that plan,
Is that
yes.
correct? Okay.
No catch.
Okay.
Yes.
So the Section 125 or HSA, whatever they're calling it, HRA, that's capped at $2,600. That's a federal thing?
Okay, you just mixed three different plans.
Okay, so
Alphabet
Section
soup.
125
Okay,
would be used to
so
call it.
Section 125, what you're probably referring to is a flexible spending arrangement.
Okay.
That is capped at the $2,600.
Right.
You can put money in
Yeah.
to pay your first dollars.
Right.
You could even use it to pay your last dollars,
Yeah.
but you will lose that money if you don't need it.
Can I
Except for
jump in right here?
Except for
you
the
can roll
500
over
rollover.
500.
Yeah, I know that. Yeah.
So we as a union are recommending everybody in a family plan puts at least 500 into a flexible spending plan because you can roll it over from the year, even if you don't use it. But that covers your first 250 and your, God forbid, last 250.
Right. But that's a personal decision. And eventually, when you leave employment, which we all hope to do someday, right, because we want to move on to something else in life, the rollover eventually, you will lose it or use it, right. But as long as you're working with the same employer, you can roll that over. So that FSA money, flexible spending arrangement, which is part of the 125 plan, is a way for you to put your pre-tax money to help you with the first and last dollar. Your employer's money is called a health reimbursement arrangement. It's money that if you don't need it, your employer keeps it. It doesn't roll over, but it's there if you need it. And a health savings account you can't use with these plans while you have an HRA. Yeah.
So that was one of my clarifications. So even if I wanted to do a personal HSA because I have an HRA through my employer,
You can't.
I cannot sell.
Right, unless you turn down your employer's money.
And
Federal law.
So then another question, the HRA, you mentioned the card. It's my understanding we don't have to use the card. We
Correct.
can ask for reimbursement.
So you're going to use Future Planning Associates, and your employer can talk about specifically how that works. That's not really my purview, but you don't have to use a card. Yes.
I just want to confirm, so the plan will follow the calendar year, and that will always be the case, but the rates will always follow the fiscal year. So you'll be on the same plan, but your rates will go up in July every year or shift every year in July, but you're still on that same plan.
Yes. So it's confusing. It's always been that way. So if you're in the 1200 comp or the 300 comp that VEHI has had, that's always how it's worked for you. But most people haven't noticed it because of the VHP.
We don't have that in our district, so nobody's on it. Well, except administrators.
Okay. So premiums are set for the fiscal year, so they go up every July. Out-of-pocket costs are tracked on a calendar year, yes. In order to meet federal rules, we track them on a calendar year. At some point, out-of-pocket costs will go up, right? So at some point, the $500 deductible will become a $520 deductible or a $530 deductible, right? Because of inflation. When that happens, it will happen when the premiums go up on a July basis. But it will be a calendar year tracking system. We did that a few years ago when we changed deductibles. So we'll give you plenty of notice for that. I know it's confusing. I wish every cycle lined up, but it doesn't. You have a comment?
Nope, I'm good.
I have a question that I think a lot of people have asked me. I have kids off at college. Tell me how that will work.
So here's the only things you need to think about with kids off at college. They don't have to list a primary care provider if they don't have one in Vermont. So if they're off in college in Michigan and have a relationship with a primary care doctor in Michigan, they don't have to list one.
What if they're using their health services at the college? Like that's...
So this health plan, these health plans work in the entire nation in any Blue Cross doctor or hospital, which is not true for the VHP. So it's been a problem for people who've been off at college. Kids usually come home to get what they need, right? But they don't have to do that. So if they've been buying their college insurance plan to have coverage, they may not need to pay for that anymore. They should just check. I mean, something like high 90s in the entire country, doctors and hospitals are part of this network.
Okay.
So they should
So I
be
could
able
call
to
that
find-
college and call down to the health center and say, hi, Tufts, are you part of the Blue Cross Blue Shield network?
You can ask them that. I don't know if often colleges have their own kind of health system, but you can go and put in the zip code in the Find a Doctor of that college and find in 60-mile radius or 30-mile radius all the doctors and hospitals in that area around that college that will participate. And then they can use your plan without having to worry about buying secondary insurance.
Okay.
And then does it matter if they're out of state and they choose, like, who they choose as their primary care physician? So
If you're out of state, you don't have to pick a primary care
So
physician.
it doesn't matter either way, there's no benefit or not to
Right.
choosing Massachusetts or Vermont.
No? Yes, Laura?
So the out-of-pocket limits we calculate every year.
Yep.
But there is no lifetime limit.
There is no lifetime limit, that is correct.
And can you tell us what the deadlines are for selecting a plan for next January?
So that's local. I can just tell you that VEHI has to know by November 15th what plan you're in. And that is a hard stop deadline because we have to submit, get ID cards and get everything in the mail to you. So we're asking employers to have your deadline before that so that they can do their work and get that information to us. And your deadline
we've said November 3rd.
November 3rd. And that's a reasonable time frame to let them do their part and get us our November 15th deadline. So you have November 3rd to make your selections. Once you make that selection, you keep it for a year unless you have a qualifying event, marriage, divorce, birth of a child, change in spouse's job circumstance, those kind of things let you change plans. Otherwise, every year you have a chance to relook at it.
When is that every year? Is it the July or
What's
January?
your open enrollment cycle?
Open enrollment's usually now. But, yeah.
January?
Yeah.
Change in
So
January?
it's always fall. It might not be quite this early. We have a deadline to move everybody that sort of pushed things up this year, but it looks like every fall you choose and your plan selection goes into effect in January.
Okay.
Is there a default plan for somebody who has insurance now and then does not make a selection?
So the way that we've set it up, it's sort of an interesting question. You have an open enrollment.
Mm-hmm.
You have a right as an employer to decide what happens to people that don't give you information.
Right.
That's your decision. You could say you get nothing. You could say this is what happens to you.
So our default is the gold CDH people.
But we have a default for when employers don't give us information.
Yes.
But that's different from what you do if employees don't give you information.
And yours is gold CDHP default as well, is that correct?
Right, but there's no reason for any of you with settled agreements to be in the VEHI default.
I understand that.
Doesn't mean you won't pick that plan for other reasons.
I just didn't want them to think that we were holding out and giving them something worse than they would get if we had a settled agreement.
No, but the question has come up in that, so I don't really need to do the paperwork?
I could just get put into it?
That's more been the question that's come up.
Well, in the past, because everybody's been in the VHP, and that's really the only choice, people have just sort of rolled and nobody's had to actively do anything. The future might look like that again, right? Where people start to say, I like this plan, I just want to stay in it. And one option employers have is to say, if you don't tell us anything, you just keep going in the same plan. They can't tell you that this year because the plan you're in doesn't exist. So this year, if you don't submit paperwork, they can't keep you where you are.
So you will go in the gold CDHP plan, but I mean, it's better. I would encourage everybody to review where they are and be active about it.
And there are some cases why people will want to pick something different from the gold CDHP. Your individual, you should look at it. You should think about what's coming out of your paycheck, what your employer's offered in the HRA, and what you know about your own family. But if you go into the gold CVHP, the way your collective bargaining agreement is set up, you're in a really good place. As you said, what your exposure is pretty limited, so you can't make a bad decision. And if you're one of those people that have too much on your plate right now and don't want to think about it, you can go ahead and actively pick that and know that you haven't made a bad choice. But there are some decision points for people who are into the weeds and want to really digest it.
If you decide not to take the HRA card, could you still submit the expenses for that and be reimbursed? Or is that money only available to you if you take the HRA?
No, there will be a way to get reimbursed without the card, but I mean, you're staying within the plan of the HRA, but yes.
That would all go through future planning, probably.
You might as well take the card, you can never use it.
Yeah.
But using a debit card is the fastest way to get the HRA dollars to work for you. Yes?
multiple cards, like if you have a daughter in college somewhere?
That's a future.
That's a future planning thing, and I think they offer multiple cards. You have to do a little paperwork to do it.
They only had 2 on the
CHRA
list.
card just for prescriptions now?
I'm sorry?
Or
No,
choose
it's
prescriptions?
you can use it for prescriptions. It's not a separate card.
If you go to the doctor and you can just swipe it there too, it's
Yeah.
for both.
So in the Gold CDHP plan, when you go to the doctor, you're not going to have to pay anything because you don't pay a time of service. You pay a time of service for pharmacy and co-pays.
But all of that comes out of the HRA money.
Right, and you can do that with your credit card, write it on the bill, and send it back in. That's all processed. We should probably let you go.
Any other questions on the health plans? Thank you.
Thank you very much.